The Zeltiq Breeze system is a state-of-the-art medical device cleared for dermal cooling and non-invasive fat reduction in targeted regions of the body through a procedure called Coolsculpting. The Zeltiq Breeze system was designed for ease of use, flexibility, and patient safety. It consists of a control unit with a large touchpad display and an applicator. The applicator delivers precisely controlled cooling and optional massage to the treatment site. 3 applicators are available to treat a variety of body areas and sizes. The EasyApp 6.2 is optimized for more tightly fitted contours, such as the flank region or love handles. The EasyApp 6.3 is optimized for wider areas, such as the back region, some flanks, and some abdomens. The EasyApp 8, the largest applicator, is designed to treat 2.5 times the tissue area as that of the 6 series applicators. Each applicator uses color-coded accessories: purple for the EasyApp 6 series applicators and gold for the EasyApp 8. Accessories include an Easy Card, which holds a fixed number of applications, an Easy Liner, which provides a barrier between patient and vacuum applicator, and an Easy Pad Gel Pad, which ensures thermal contact between the applicator and the patient's skin. What is Coolsculpting? Coolsculpting utilizes a precisely controlled cooling method called cryolipolysis to target, cool, and eliminate fat cells without damage to other tissue. In the USA, Coolsculpting is cleared for dermal cooling on the body, as well as non-invasive fat layer reduction on the flank region, or love handles, via cold-assisted lipolysis. Outside of the US, Coolsculpting is cleared by Health Canada, the European Union, and additional international markets for non-invasive fat layer reduction on the body via cold-assisted lipolysis. Appropriate patients. Proper patient selection is critical to ensure excellent results and maximize patient satisfaction.
The best patients for Coolsculpting are patients that have pockets of fat that are resistant to diet and exercise, that have distinct borders, and not diffused fattiness. The fat that's best treated is fat that's pinchable, able to be pulled away from the body and drawn up into the applicator.
Patients should also be at or near their ideal body weight and have good skin tone with minimal laxity. Coolsculpting should not be used on patients with cryoglobulinemia or paroxysmal cold hemoglobinuria. Pregnant or lactating women should also not be treated with Coolsculpting. As with all medical procedures, physicians should use their clinical judgment in evaluating and treating patients with Coolsculpting. Setting patient expectations. To maximize patient satisfaction, it is important to discuss the Coolsculpting procedure with each patient in depth prior to a procedure. To set realistic expectations, outline the basics of what happens before, during, and after the procedure. Describe what typical results look like and how long it takes to see them, and discuss possible side effects. In terms of efficacy, patients typically see a 20% reduction in the thickness of the fat layer. Results are visible with a single procedure, but multiple procedures may be recommended depending on the patient's aesthetic goals. Results may be observed as early on as 3 weeks, but full results will be visible in 2 to 4 months. System setup. The system will not function without an Easy Card. To insert the Easy Card, align it with the slot on the applicator and insert it into place. The system will take about 2 minutes to boot up and authenticate. After authentication, the touchscreen display will show the number of cycles remaining on the card. It is good practice to keep an extra Easy Card in stock in case you run out of cycles. Assess, plan, and place. Assess the patient's fat, plan the treatment, and place the applicator. Remember that Coolsculpting works best on distinct bulges that have well-defined borders. Place the Easy Pad. Remember to use the appropriate Easy Pad for the applicator. The Easy Pad is designed for use on a single application site only. Reuse may result in tissue injury. Use of a damaged Easy Pad may also result in tissue injury. If an Easy Pad or its packaging shows signs of damage, do not use it. To place the Easy Pad, ensure that the patient is in a comfortable position. Open the pack and gently grasp 2 corners on a long side of the pad and lift it off the package horizontally. Drape the Easy Pad over the center of the application site. Gently place the pad into place. Working from the center outward, Gently smooth the Easy Pad to eliminate any wrinkles or bubbles. Confirm Easy Pad placement by pressing the Gel Pad button on the touchscreen. Finally, to place the applicator, position the patient appropriately based on the treatment area as shown in this chart. Once the patient is placed, turn on the vacuum either on the applicator panel or on the touchscreen. Only turn on cooling after the patient has been comfortably positioned. When the vacuum is engaged, it is indicated by a constant blue LED indicator light.
When applying the applicator to the patient, it's important to ensure that the X goes directly in the center of the applicator cup. Use the on and off button on the top of the applicator as a guide to where the center of the cooling panels are.
Place the applicator directly on the patient, perpendicular to the tissue. Do not roll or rock it into place. It is critical to ensure that the Easy Pad extends beyond the edges of the panels in the applicator cup, indicated by the gray casing. If the placement is incorrect, turn off the vacuum, remove the applicator, and replace the Easy Pad. Once the vacuum starts, check the tissue in the applicator cup. If the vacuum is insufficient to draw the tissue visibly into the cup, then poor efficacy may result. Remove the applicator, consider increasing the vacuum setting, and then reposition the applicator. Starting treatment. Prior to engaging the cooling, make sure the patient is comfortable. First, place the patient support pillow.
The pillow is used to support the applicator and take the weight of the applicator cup off of the patient. Prior to starting the cooling sequence, you want to ask the patient to ensure that they are okay to sit in this position for an entire 60 minutes. Are you comfortable? Okay. You can engage the cooling and start the treatment by either pushing the power button on the top of the applicator pad or also on the user interface. I'm going to start the treatment now at the top of the applicator pad.
Many patients find Coolsculpting a comfortable procedure, though there may be some discomfort at the start of the procedure, particularly during the first 10 minutes. It is important to prepare patients for a feeling of vacuum pressure and intense cold, though this typically resolves as the area becomes numb. After treatment. When treatment ends, turn off the vacuum. Slowly remove the applicator by breaking the vacuum seal. Remove and discard the used Easy Pad. Wipe the residual gel from the treatment area. Post-procedure, the treated tissue may appear red and raised and may be cold and firm. These changes resolve within a few minutes to a few hours. Bruising, soreness, tenderness, cramping, and pins and needles sensation may occur, but usually resolve within a few days to a few weeks.
Okay, so you can see over here in the treatment area, it's a little bit of bruising, some erythema or redness, all very normal, very common. I'm sure the area feels pretty numb. That's normal. And sometimes tender to the pressure. That is absolutely normal as well. Okay?
In rare instances, some patients may experience significant pain after treatment. This side effect occurs in very few cases and usually resolves within 2 to 3 weeks. The physician should be contacted if any patients report severe pain following the procedure. Offer the patient a cup of water after treatment to ensure they are not lightheaded, and send the patient home with the take-home guidelines.
These are your take-home instructions. They're going to tell you what to expect in the days and weeks following the procedure. All of the things listed on this page are expected. They're normal. They vary in frequency and they vary in intensity, but it's all very normal. In the event that there is any questions that you have, please call me.
Patient photography. Photographs should be taken before treatment and at each follow-up visit. The key to good photographs is consistency in lighting, camera settings, patient garments, patient positioning, backdrop, photographer, and room. Ideal rooms have low traffic and no windows. Mark the positioning for the camera tripod, lights, and patient with plastic-colored tape or marker so it is easy to reposition exactly. The backdrop should be a cloth with contrasting color attached to a wall. Pure white, medium gray, or black is preferred. Use patient garments, not street clothes, for consistency in the photographs, and use the patient positioning guide for consistent positioning. See the photography training guidelines for detailed instructions.